Hello, everyone. I'm Dr. Misty Paul, and I have a company called Basics First Chiropractic. So that makes me a chiropractor. And today I am joined by my very good friend, Allison Tepper, who owns Tepper Nutrition. Allison, welcome.
Thank you so much for having me, Dr. Paul.
It's just so nice to be able to sit and chat. And one of the reasons that I wanted us to have this chat is because people are just so unfamiliar with why would one of our patients require both of us. So we're going to get into that just a little bit. And but before we do, can you tell the audience a little bit about you?
Yes, so my name's Allison Tepper. I have my business called Tepper Nutrition. We are a team of dietitians. We work with clients with a range of needs, anything from GI conditions to emotional eating, eating disorders, new diagnoses, high blood pressure, high cholesterol. Between the five of us, we can kind of see a range of different things that people might want to come in for, and even just to talk about food in general, because food can sometimes be a little bit confusing. So we're here to answer any questions around that. And we are based in Leesburg and work virtually with clients.
I love that. What makes you different, do you think, and so unique? I know you to be unique, but tell everybody why they should see you instead of somebody else.
Well, I think that we really cover nutrition from a foundational level. We are definitely taking a look at food intake and, coming up with recommendations and a plan that feels good for clients, making sure they're getting in that balance. But we also really take the time to get a good understanding of your relationship with food, your history around food, any familial dynamics, cultural experiences, you name it, just to get a really good understanding of what drives different food choices, what might impact different decisions, and just kind of taking that all into consideration when making recommendations. So very like behavioral around food, and then of course the nutrition recommendations and kind of combining the two, just so it feels really sustainable and doable for people, and that we're kind of getting to the root of anything that might be getting in the way of making change.
That sounds great. And I know from having worked with you through patients that one of the things that I love about you is that you're very intuitive in not just taking away, but what are the good things that you can add in, right? And that goes hand in hand with intuitive eating, emotional, behavioral eating.
Mhm. Yes, absolutely. Our philosophy is really rooted in intuitive eating and kind of, again, that this balance of, the science of nutrition, but then what is going to work for you as an individual and really kind of going more internal versus external. Yeah. And definitely like, what can we add in? How do we find that flexibility and enjoyable aspect of food and really focusing on a positive approach to food? That's the big piece of what we're aiming for with that for sure.
Um,
Yeah.
So, when people come in to see me, they're coming in for all sorts of different pain syndromes, whether it be neck pain, back pain, pain down arms, legs, what have you, headaches. And the last thing that they're thinking is, oh, I need to also see a nutritionist about this. And more research is showing not just a gut-brain axis, and we've now started learning that healthy gut means healthy us, right? Healthy body, healthy all around. But there's also actually a gut joint axis that if you treat your gut well, your pain level can be affected. So as far and so that's one of the big reasons I feel that most everybody that's coming in to see me should automatically at least have a consultation with you. But as far as people in pain, what would you say the focus is for you?
Yeah, absolutely. And I'm excited to hear your aspect and how you approach things as well. And definitely, there is such a correlation between pain and other factors like stress and exercise and all these things. When it comes to food intake, at least how we are approaching it is kind of getting a good sense of what might be causing some inflammation when it comes to food. And, that could be in terms of like things that are missing and what we can add in. So maybe, focusing on healthy fats and omega 3s coming from fish and walnuts and seeds and things like that. Adding in these foods that are rich in antioxidants that fight off free radicals, so things like fruits and vegetables. So how can we add these really beneficial foods into our diet to help reduce inflammation, help with joint pain? Healthy fats like avocado and olive oil, those can definitely make a difference as well. Water intake, of course, too, is huge. So really being able to
Yes.
lubricate the joints. So really kind of taking a look at the baseline of someone's diet and okay, what can we add in? And then we're also looking at things that can cause some more inflammation in the body. And again, not cutting them out completely, but how are you incorporating these foods in a balanced way? So that might be looking at red meat intake or fried foods, sugar intake. All of these things fit, but we want to be mindful of the amounts. It's what we do more consistently that really makes the biggest difference in our health long term. And so what are we eating more of, and how can we focus on these foods that are really going to help assist us in managing any chronic pain that might be coming up? But that is typically, what we will address. But then I do have that, okay, you're experiencing any type of pain. Food is a big part of this and can play a role. And let's explore this further and make sure that we're not missing anything, that you're getting tested for anything that needs to be addressed, that you're working with the right professionals. And that's definitely where I then send them to you, to focus on the joint pain, their alignment, and anything else that you can test to see what might be coming up for them.
That sounds wonderful. And then a biggie is, so as you said, we want to decrease inflammation by balancing out how much pro-inflammatory foods they're eating, whether it's fried, whether it's sugars. And yes, as always, it's hard to take it away completely, but a good balance, everything in moderation is what you're recommending. Then the other part of it is anybody that has joint pain, has degeneration. We want to be able to help them increase their protein intake. And we want to look at ways for helping the body repair, right? We're talking about repair of joint, bone, muscles, ligaments. How do we do that?
Yeah, absolutely. I mean, there's a lot of conversations around protein right now, and absolutely protein intake is essential. We want to make sure that we are getting it throughout the day in order to maintain protein synthesis and muscle repair and all those really important things, which then helps not only our muscles, but also our bone strength. So really looking at the big picture here. And with protein intake, I think that it's like everything else. We need to incorporate it throughout the day. A lot of times if people are, missing meals or going too long without eating, we're also missing the opportunity to get in more nutrients that are really beneficial. So, okay, what can we add to breakfast to make sure that there's a protein source? Making sure there's protein every time we eat also helps to keep your blood sugars more stable and also helps to keep you more full. So we're looking at maybe adding things like eggs or other protein sources at breakfast. Even dairy will give you some protein as well, nuts and seeds, things like that. What can you add at lunch? Kind of taking a look at what your baseline looks like and then what we can add in that will help you to reach your protein goals. But I would also love to hear on your end the recommendations that you make in terms of protein and other nutrients that can help with the inflammation and joint pain as well.
Yeah, absolutely. Well, I'm a big one for protein as I'm sitting here having my protein shake this morning. And I agree with you. A lot of people are the age group that I see from 40 to 65-year-olds. That's not everybody that comes in, but most people. And that age group, they get into this phase of life when all of a sudden they want to skip a meal and because they're worried about weight and calorie intake. But unknowingly, they're missing the most important nutrients. And so getting them to understand that protein will actually be satiating and it will keep your cravings down from wanting to delve into that, jar of M&Ms that maybe a coworker has brought in or other pro-inflammatory foods out there. But some other things that I will also look at will be vitamin D levels. I'll also look at magnesium. Um, and then, creatine is a good one to look at for joint health too. And many times there's people that would like to be tested, and so we can certainly test levels. I can, do testing from food sensitivity testings, GI maps, to also just running blood tests to see where vitamin D levels are, or even omega-3 levels are, if that's what somebody needs as a starting point too. So decreasing inflammation, increasing the repair through our diet both become so important. Let's see, is there anything else that I wanted to ask you? Is there anything that we missed out on that we should chat about?
Good question. One thing I would note, I think, is carbohydrate intake as well. I think sometimes what can happen is that when we increase our protein intake, sometimes we're missing out then on the most important fuel source, which is carbohydrates. And I mention that because we're talking about muscle mass and muscle synthesis. And when we are not eating enough carbohydrates, our body starts to use protein as a fuel source, which we definitely want to make sure we are maintaining our muscle mass. And if we aren't getting enough carbs, our body can start to break down our muscle mass for energy, which we want to avoid because we want to preserve our muscle mass. So I mentioned that in that sense that we want to make sure we're getting in carbohydrates in addition to the protein and fruits and vegetables and fats. So I just wanted to mention that as a plug for carbs, the importance of them.
I love that. And these days, carbs are just confusing to people. So, can you mention some good carbs that you
Oh,
would recommend?
absolutely. I mean, definitely, the
Yeah.
recommendation is to make half of your grains whole grains. They don't all have to be, but that will add some additional vitamins and nutrients and fiber. But really, anything goes. I don't want anyone to be afraid of different types of carbohydrates. It's just, how we're eating carbohydrates in combination with the other food groups. But if we're looking at good sources like whole wheat bread and potatoes and sweet potatoes and, brown rice or different rice options, couscous, quinoa, crackers, tortillas, whatever carbohydrate sources work for you, incorporating that in combination with the other balance of nutrients.
I love that. That sounds great. Um, I don't think I have any other questions. So I loved having this talk with you, and I'm certainly going to post it on the website. And I hope that my patients reach out to you. And I think that between the two of us, we're going to provide them with even better care.
Absolutely. Likewise, I agree. And I can put in a plug for Dr. Paul. I am a patient of hers and she is amazing. And I've just enjoyed our work together. So thank you.
Thank you so much, Allison. Talk to you soon.
Okay.